You know, I think when we last talked, yeah, we were, I think I hadn't, at the time that we were working together, I had not made the full leap into the psychedelic world yet, with both feet planted firmly in that world. I was kind of, you know, I had one foot in the more traditional psychotherapy and also medical psychological world of, you know, working with patients with chronic pain and
Right.
doing that work, and that was really fulfilling. But I had felt for a while like I really, you know, my true calling was to do work with patients with psychedelic medicine, and that was something I don't even know if we had talked about that. I imagine I mentioned it to you.
Well, yeah, you did.
Yeah.
It was part of your world. I think you were exploring it for yourself too, but you were involved with MAPS at least a little bit.
Yeah.
Because
Okay.
remember we did the holotropic breath work.
Right. Yes.
And there was some sharing a little bit, just like so not we didn't do anything together, but I knew you were exploring it.
Mm-hmm, mm-hmm.
But not professionally.
Yeah. So, you know, regarding that, I want to be careful not to talk too much about my own
Totally.
personal experiences with illegal substances.
Mm-hmm.
You know, but I will kind of refer to it. I'll refer to it because that is such an essential part of my story. But I may not go into detail about my own experiences as much.
As a provider, I want you to talk about what you feel comfortable with. I know other people have been on camera, but they say they do it in areas of the world it is legal, you know, so
Right.
they don't say that's here, whether it is or not, you know, that part. And so even on Goop Lab, when they did their interviews with mushrooms, I think is what they were focusing on. They were down in Jamaica, I think, where it was legal. So,
yeah, and you know, one of the things I can talk about is the holotropic breath work and how profoundly impactful that's been.
Okay, hang on. Yeah, we'll talk about that. My phone decided to start playing music. Hold on. What the heck? My Kundalini wants to get activated. Okay, back to you. So holotropic breath work. Yeah, let's touch on that, because do you do that in your practice too? Oh, you froze.
Yeah, sorry, I hear you now. Yeah.
Okay. Do you do holotropic breath work in your practice?
I don't offer that in my practice. You have to go through, you know, a couple of years of training, and I've just not had the time and energy to do that. But I'd love to be able to offer that at some point.
Okay.
Now that I'm working with ketamine, it's a pretty potent, powerful substance that can elicit very similar states of consciousness. So I feel like right now my focus is on ketamine.
Sure.
Another experience that I had that I can talk about is the MT1 study that is done by MAPS through Annie and Michael Mithofer, and basically it's they're giving healthy volunteers a chance to experience MDMA psychotherapy, and it's specifically offered to study therapists in the MDMA study, so that the therapists themselves can have an experience of the MDMA, so they know what their patients are going through. through what participants are going through. And so I had a chance to work with the
study.
With the study and with the myth offers who are the principal investigators of the phase 2 MDMA trials. And that was an amazing experience. So I can talk freely about that because that was in a legal context.
Excellent. Okay. Yeah, let's talk about that. Because what I'm hoping to do is to reach to other therapists who are doing traditional talk therapy, which only gets to the conscious mind, doesn't get to that subconscious and then heart connection, and see how we can help open their minds to it. But then we're also talking to the participants or people who've been in therapy, maybe, who haven't had the results that they want.
Yeah.
And to let them know that there's other options that are being explored right now.
Yeah. Great.
Yeah. Good. All right. And I'm probably going to piggyback you with brain spotting. The national trainer for brain spotting, Lisa Larson. So she's doing some pretty amazing work too.
Okay.
So that's the kind of the concession. We're going to go in, order. All right.
Okay. And tell me, what is brain spotting?
Brain spotting is EMDR. Have you heard of EMDR? Okay.
Yeah.
So it's the next level of EMDR. So EMDR, you're going with a stick and you're focusing your mind and your eyes and they're asking you questions and the stick keeps moving. Well, I can't remember the name of the developer. I'll send you a link. But when he was doing brain spotting, what he would find is when you get onto a certain trauma point, your eyes would like twitch or they would flutter or there would be movement where they could gain access in the brain to that memory and the layers. So if you held the stick right there, it would open up the layer of that particular trauma. So it's like a next level therapy to EMDR.
Gotcha.
It gets more specific.
Gotcha. Interesting. Yeah.
It's very interesting, and I have done it a couple of times, and it's been pretty profound in enlightenment of and then what they do is they work that point so that instead of being triggered at a 10 or 8 or 9, you're triggered like a 1 or a 2. So you're aware of it, it doesn't go away, but it's not as explosive of the emotion.
Gotcha.
So that's what that is.
Cool. Yeah. I do some EMDR in my practice, and it's a really very, very effective way of processing trauma. And I've always felt like, you could go deeper into that. So I'm always curious about other kind of iterations of that work.
Yeah, Lisa Larson, she's one of the national trainers with them, one of and phenomenal woman. And so I'll get you her information because it's a next level for sure.
Yeah. Cool.
Without any drugs or anything. I wouldn't recommend still drinking on it. My boyfriend said it didn't work out so well.
Oh gosh.
No deep trauma work while you're still self-medicating. All right. I'm off my lecture now. All right. So I'm going to pre-record my introduction of you. Just basically, okay. I'm going to read what your bio is.
Okay.
I was going to read a little bit of your bio, but I can't see it. Let's see. Is there anything else you want to specifically talk about or share? Is there something you're working on, something that's coming up, something unique that you're doing there at Polaris?
Yeah, the work at Polaris is really my focus right now. So that's something that I will love to get into and share with the world. The MAP study is even though we're kind of on a little hiatus with the COVID crisis, we are, in full swing with phase 3. So that's something that's exciting, and I can talk about that. And
great.
And then just kind of like the healing, my thoughts on the healing process more generally, what healing looks like, and you know, it's still an open question for me, like what healing is and what healing looks like, and I think it looks different for different people. So,
Sure.
but it's I think there's some kind of invariant features of healing across subjective accounts that we can kind of identify as being kind of part of the overall picture of healing, and so yeah, we can
Maybe we can start there. Maybe we can start with you know, I'll do the introduction. We'll roll into what is healing of in your philosophy behind your practice and what you're doing. Then we can go into what you're currently doing, and then what you've been, your history, what got you into wanting to explore this method with MDMA.
I kind of I would kind of like to start there, Rochelle, if possible, like just kind of, I guess, telling my story about how I got to where I am, and then kind of go into the more abstract, you know, ideas about healing.
Do it reverse? Perfect.
Yeah, if that works.
Okay. Yeah, that works. Okay, so help me with the pronunciation of your last name, please.
It's Sienknecht.
Sienknecht.
Yeah, one of my patients told me I never made this connection before, but sync, like syncing two devices,
Uh-huh.
and then connect.
Sienknecht.
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 Yeah.
Okay. Well, okay, so I'm going to go ahead and get started.
Okay.
So today, thank you, Eric, for joining us. This is Dr. Eric Sienknecht. He's a licensed clinical psychologist and sub-investigator and therapist. He is currently in the clinical program for MDMA-assisted psychotherapy through MAPS, and has joined us from San Francisco, where he practices at the Polaris Insight Center. Welcome. I'm going to call you Dr. Eric. That's how I know you.
That's fine. Thank you, Rochelle. Great to be here.
Great. I'm glad to have you here. We had an opportunity to work together a few years ago, and I was so inspired with what you've been doing the last several years. I would love for you to share with our listeners about how you got into your work, and share a little bit more what you're doing.
Sure, yeah. Yeah, so let's see, we know each other through the San Francisco Functional Restoration Program, where we worked together back in 2014 to 16, I think.
I think so, yeah.
Where I was specializing in working with a multidisciplinary team treating injured workers in the workers' compensation system, focusing on the treatment, the multidisciplinary treatment of chronic pain, from medical, but also from psychological perspective. And that's still a specialty of mine. And I like working with people who are, have been injured or in pain, various chronic medical illnesses, and working with the psychology of pain.
Well, it was pretty cutting edge back then. I mean, we were integrating nutrition and movement and exercise along with psychotherapy to help people to get off their assisted living and get back to work, right?
That's right.
We had some really good success through that program.
For sure. Yeah, it was a great program. It was kind of very innovative and integrative and cutting edge, particularly in the workers' compensation system, which tends to be quite conservative in terms of treatment. So we were kind of pushing the limits there, and I think we had great results. You know, and it's interesting when I think about the people that we were treating. You know, a lot of them were people, you know, who had been working their whole lives for a company and had put everything into their work. A lot of them were workaholics. And, you know, they were very loyal to their companies and, you know, and I think at a deeper level, they were very much programmed or self-programmed to put aside any interest or concerns about their inner world in order to sacrifice to make the sacrifice to their work so that they could provide for their families and this and that. And this is how a lot of people, you know, have to live in order to make ends meet. They see kind of spending time exploring their inner world as a luxury, as something, you know, that they just have not had time or space to do. And then they get injured eventually because of various reasons, but sometimes it's due to an ignoring of their bodies and how much their bodies are really being pushed to the limits with their work.
Right.
And to the point where like they can no longer continue doing the things that they've been doing. Their body has broken down. And so this is actually a very pregnant time of potential healing. When someone gets to this point, they can no longer work. They can no longer follow the old program, right?
Right.
They're forced to be open to new ways of engaging with themselves and engaging with others, engaging with the world. And they have to reinvent themselves and redefine their relationship with their work. And so I felt there was a great need for psychological intervention at that time, because there's a chance to really, really look at what's going on and how the identity that someone's built up, and then who are they without their work.
Sure. Right. I think a lot of that's happening right now with everybody at home.
Oh, for sure. Yeah.
Yeah.
There's great potential right now for looking again at ourselves and reinventing ourselves because of the limitations that we're faced with the COVID crisis. Yeah.
Exactly. Yeah.
Everything's slowed down, right?
Right. Well, yeah, everything slowed down and you're at home, and you know, it's or work has shifted so that you're working from home and kids are all home. And so I'm finding quite a few people are finding more anxiousness come up, or some awarenesses of what they've neglected.
Yes.
In sacrifice of something else they deemed more important, and honestly, sometimes in avoidance of, right? The things
For
that
sure.
you don't want to look at, too painful to look at.
Yes.
Sure.
And exactly. Yeah. So we have a chance to look at how we've been resisting, avoiding, denying certain things, certain aspects of our own personal growth and healing that we now have a chance to really put some energy into, and it takes rejuggling, reorienting, and it can be quite distressing for people to oh wait, I don't have that anymore to lean on, so like who am I, and what am I doing, and where am I going? And I think it's distressing and also potentially very rewarding to start to ask those deeper questions and look at those deeper issues.
Certainly. So after our program and us working together in that project, you started with Polaris? Was that?
Yeah, well, so around 2016, I got involved with an organization called MAPS, Multidisciplinary Association for Psychedelic Studies. And they were looking at the potential for the drug MDMA, or ecstasy, to treat PTSD, so severe PTSD.
Mm-hmm.
And at the time, they were involved in phase 2 trials of MDMA for PTSD, and they were looking for study therapists to come on to they wanted to increase the number of therapists on their study as they went into phase 3, which is a much larger scale phase of the drug development. And I was one of the lucky few that got chosen to train with MAPS. And so we went through a year-long training. And during that training, I met some really extraordinary people who were also very passionate about psychedelic medicine. And we, it was five of us in the training who decided to really take it to the next level. So we were involved in the study with MAPS, but we also, but MDMA is still illegal, right? We're still developing the drug, and we're hoping that it will become a prescribable medication by 2022.
Okay.
But
Can Eric, just for those that are new to it, what exactly is MDMA?
Oh, MDMA is MAPS calls it a psychedelic. I think of it as a psychedelic, but it also has a very stimulating aspect to it. So the way that MDMA works in the brain is it's actually really almost perfectly designed to treat trauma. In this sense that we've looked at fMRI studies, and basically when someone's under the influence of MDMA, the activity in the amygdala, which is the fear response of the brain, is reduced significantly. People who are traumatized are often in this chronic state of fight or flight, where their amygdala is overly developed and it's firing all the time, and they're constantly hypervigilant and guarded and anxious and having nightmares, and they're in this kind of chronic traumatized state.
Right.
With the MDMA, you're lowering the fear response significantly, so they have an experience of what it's like to be without fear in the world.
That would be lovely in its own, just on its own, right?
Yeah, I mean, yeah. And it's kind of hard to imagine what that might be like, because I think most of us live with some amount of fear on a daily basis, whether it's anxiety about paying bills or this or that. There's right. some level of fear that's running in our programs. So so it's a chance to really experience who we are without fear. And then in addition to that, Rochelle, there's also an increase in the prefrontal cortex activity, which is the thinking center of the brain, and our capacity to rationalize and think clearly, and also to think creatively, think outside the box. So you have an increased capacity to think without the fear response interfering with that process. And then in addition to that, there's an increased connectivity between the hippocampus and the amygdala. And usually for people who are traumatized, the amygdala is firing and interfering with one's ability to reconsolidate traumatic memories in the brain and the nervous system. Without that interference of the amygdala, there's now the capacity to reconsolidate the memory in a new way and store it in a new way in the brain, so that you can actually re-experience the trauma and go back into it, and be able to think clearly about it and gain perspective, and even see it in a new way and experience it in a new way.
So instead of looking at it through the lens of fear,
exactly,
and imprinting from that old experience and how that locked in, you get to watch what happened almost as if you're witnessing it and it without the emotion?
Well, it's definitely, you can see it from witness perspective. And I would just say that you have access to the full range of your emotions
Okay.
rather than just the fear, right?
Okay. Yes.
So
Yes.
you can actually be in touch with sense of, for example, self-compassion,
Mm-hmm.
being this being who is yourself going through this experience and be able to feel deeply empathic and even to grieve and to cry and like um, feel anger, feel, you know, it's people have on MDMA, they have um, very emotional experiences usually, like but with a wide range of emotions. One,
More releasing of the emotions that have been maybe.
I think part of it is releasing, and then part of it is also part of it is releasing, crying, purging in a way, and but also people get in touch with euphoria, people get in touch with bliss, ecstasy. You know, it's called ecstasy for a reason. Now, and I think that there is an important role that bliss and euphoria and ecstasy have to play in the healing process.
Yes.
And this is something that's not talked about a lot. I mean, I think the general, a very, very traditional idea about healing trauma is that you have to really go into the trauma and you have to, and it's very hard work and it's a lot of pain and suffering. And some of that is true. And that's true for a lot of people. And I would just say, and it can also be a really uplifting, beautiful, meaningful, blissful experience, a heart-opening experience.
Yeah.
For some people, it's the first time that they're feeling a sense of deep compassion for themselves.
I'm really glad you brought that up, because so many of my clients, when I work with them, what brings you joy? And can't, they don't know.
Yeah,
We
I
have to
don't know.
go on this exploring, experiment, because
Mm-hmm.
they don't have access to that deep connection to what just brings them pure joy.
Yeah,
What it is
yeah.
to be truly happy. And it almost freaks them out. If they feel a little bit of it, they're like, whoa, something's got to be wrong. And they start looking for what could go wrong, right?
Yes, yes.
Yeah.
And I think that's, you know, there's this kind of Protestant ethic that a lot of people have been raised with, and particularly in the US, where, you know, you shouldn't experience joy or pleasure without really working hard, and then you can experience a little bit of pleasure, but, you know, don't experience too much, you know, like,
Right.
yeah.
And it's this whole construct of work hard, work hard, work hard. And when you retire, then you get to enjoy life.
Right,
Or,
right.
it's always way off in the distance
Yes, yeah.
for money. The American
Yeah,
dream isn't so American dream when you're working so much.
yeah.
And
And
not,
then sometimes it's too late then, like, or
yeah.
it doesn't turn out the way that you were imagining, and so then you've wasted all this time, like, uh,
Yeah.
so yeah, I mean, we really are introducing this new way of being with oneself that is based on, you know, self-compassion and spaciousness of self.
Mm-hmm.
And one other thing I should say is, and the other physiological effect of MDMA that I should mention is that it increases oxytocin, which is the love hormone. This is the hormone that new mothers produce in order to bond with their infant. It's pro-social. This, you know, obviously helps with a therapeutic alliance. It helps the patient to bond with a therapist and to really be able to be more vulnerable and open-hearted, and which really helps the therapeutic relationship, which in turn provides more support for the patient's process.
Sure.
So it's really, MDMA is a pretty wonderful drug for treating trauma. It has all of these different aspects, and it's almost like a key in a lock. It just really fits well. And in phase 2, we they they found that 54% of people who were diagnosed with severe PTSD no longer met the criteria for PTSD a year in the year follow-up. So a year after taking, let me just back up. The treatment is 3 experiential sessions. So the patient takes MDMA 3 times over the course of about 12 months.
Okay.
About once a month. And then there's 12 non-medicine sessions before and in between the experiential sessions in order to provide support, integration, preparation in the beginning.
Sure.
So it's a 12-week treatment. So a year after they went through the 12-week treatment, 54% of people no longer met the criteria for PTSD.
Okay.
Which was in comparison with the placebo. The placebo was 23% no longer met the criteria. So almost over twice as many people.
Pretty significant.
Significant results.
Sure.
And so now we're in phase 3, and I can't talk in detail about it because it's a scientific study and it's FDA supervised. So we have to be careful about saying anything about the results. But we're in full swing. We're about halfway through, probably another year or so of the study before we can publish the results and hopefully get it into phase 4, and it can become a prescription medication by 2022.
Okay. So what's the intention for MAPS if the trials go through and it's deemed effective? Would this be available to psychiatrists, therapists? Who would it be available to for?
Yeah. So this would be a prescribable medication that it would have to be prescribed by a medical physician, psychiatrist, but the therapists who would be working with the patient in the therapy room would be psychologists, and that's still something they're working out, whether it would need to be a psychologist or whether it could also be MFT, marriage family therapists.
Yeah.
And they would need to be licensed.
Sure. How long does a session last for people?
Lasts for 8 hours.
Okay, so it's an intense.
It's an intensive, in the
therapy.
It's an intensive therapy. They come in the morning. We do some preparation. They take the drug. We sit with them for 8 hours. We take their blood pressure. Occasionally, we kind of monitor them medically. We just make sure they're taken care of.
Well, and I know this is a clinical trial. So is this in a clinical setting, like a hospital room setting?
No, this is actually in our clinic in the Castro. So we're one of 14 clinical sites around the country who are doing this study.
Exciting.
So we do it in our clinic, the San Francisco Insight and Integration Center in the Castro in San Francisco. And the patient comes, has the experience, they spend the night at the clinic, and then they have an integration session the following day, and then they can go home.
Okay.
Then we do follow-up integration sessions every week, and then they'll have another experiential, then follow-up integration sessions, another experiential. So.
Okay.
And the other thing about the study design is that there's 2 therapists in the room. So there's a male and female therapist that are sitting with the participant the whole time.
Okay.
So that's a little bit about the study, and so that is really exciting work, yeah, but we were, some of my colleagues and I were really wanting to get started with working with psychedelic medicine sooner than 2022, right?
Mm-hmm.
Wanted to, and there's actually a drug called ketamine that is legal to prescribe, and at certain doses does elicit psychedelic effects.
Okay.
So we decided to really focus on getting training and working with ketamine. We trained with Phil Wolfson and Julian Andrews and Marin. They have a ketamine training center. And we also trained with Raquel Bennett in the East Bay. And we're lucky that two of the, you know, two of the most well-known and experienced ketamine providers are here in the Bay Area. So, so we got some good training, and then we opened up Polaris in 2018.
Okay.
And we're actually providing the ketamine-assisted psychotherapy out of the same clinic that we're running the study. So
Okay.
we do MDMA and ketamine-assisted psychotherapy in that clinic. So ketamine is an interesting drug. Technically it's a dissociative, so it's not a classical psychedelic. And what a dissociative does is it basically numbs the body. So someone who's under the influence of ketamine is at higher doses, they are no longer aware of having a body. So all of the sensory information that they're bringing in through the eyes, the ears, the nose, everything, it is kind of shut down and numbed.
Interesting.
So so with classical psychedelics, it seems to almost have the opposite effect, in the sense that, you know, when you're under the influence of a psychedelic, your sensory apparati are fully potentiated, and you're like feeling everything fully, and you're like in your body. And particularly with like the plant medicines like ayahuasca, psilocybin, peyote, it's a very typically embodied experience. So you're feeling the body load of the medicine. You might feel nausea. You might purge. You might, you know, it's a very embodied experience for the most part. With ketamine, it's the opposite. You're like not in your body at all. But it's interesting that you can get to similar states of consciousness with the classic psychedelics and with ketamine. It's just different kind of routes.
Different routes, yeah. So it's turning the body off.
It's turning the body off, exactly. And
I mean, I can't even imagine what that would feel like.
So, well, it's funny you say that, because I imagine you've had experiences with the flotation tanks.
Well, yeah, I mean, so you're more astro projection type feeling, like you're out and up above and watching, like in the flotation tanks, those would happen.
Yeah, exactly. That's more like that's more of the kinds of experiences that people report under ketamine, is being outside of the body, floating, feeling like you're floating above your body, or even further, you're floating through space.
Okay.
There's a feeling of lightness. There's a feeling of oftentimes of liberation.
Okay.
The body. It's philosophically, it's just a fascinating thing to imagine. Who are we if we're not our bodies? What exists beyond the body? And in my experience, and from what I've heard from people that I've worked with, there seems to be something beyond the body.
Yeah.
When the body's turned off, as you say, something persists. And what I might call it, consciousness.
Sure.
And what is consciousness? That's a great mystery. But it seems that consciousness is expansive, possibly all pervasive. There's some philosophers that talk about consciousness as the primary substance of the universe.
Sure.
That consciousness exists before all material manifestations.
Right. Right. I mean, that's like, who are we? Who are we? Like, really, that's the
Yeah.
ultimate question, right? How do we fit in with the universe and the world and each other? How
Yes.
does all that expand? I mean, it's a big topic in the energy world of being able to study the vibration of thoughts, feelings, and emotions. And that's a whole nother conversation, but it's expansive. It's beyond our bodies, for sure.
Yes. Yes.
And you've experienced that. I've experienced that, even with holotropic breath work. Right?
Yeah. Oh, yeah. Holotropic breathwork is a wonderful treatment modality that it was originated by the Czech psychiatrist Stanislav Grof. He worked with LSD with patients back in the 70s before it was made illegal.
Right.
And he had some incredible results from that work, and he published a lot of studies, and there were hundreds of papers and studies done with LSD, and it was considered at the time the most promising drug to most promising new discovery in psychiatry ever. And then it became illegal, and all of the research just stopped, and LSD went underground. But from those experiences, he was so inspired by what he had witnessed that he created this modality called holotropic breathwork, and essentially to mimic the psychedelic experience. So holotropic breathwork is a combination of deep breathing with evocative music.
Yeah.
And using these two tools in combination, you can go into a trance state and have very profound and psychedelic experiences.
Yeah, even out of body. And I loved about the holotropic breath work so much is the container. Like, you're given permission to act out in ways that you normally would be considered not necessarily, I don't want to say inappropriate, but your body has a memory, and you're able to act that out, or speak it out, or yell it out, or cry it out, or laugh it out. I mean, we were in a room, I think of 40 couples or so, and everybody was having these different experiences, going through the same journey, same music, same breath work, right? It's just profound.
It's right. And the word catharsis comes to mind, like the therapeutic value of catharsis in the proper setting, in a supportive container, as you say. That it's just leads to profound release and healing, I think. And so, and people can have out-of-body experiences and even near-death experiences and mystical experiences in this state. You mentioned this body memory, and I think it was with holotropic breath work. I've done it a few times. That I really hit home for me the way in which our bodies store memories at a cellular level, at a deep level, and that you can access memories through working with the body. And so by breathing into my body, connecting my breath, connecting with the higher vibrations of the music, I got in touch with my body in a way that I'd never been before. And in one of my experiences, I was just taking these spontaneous yoga positions with each, I would go into like the wheel, and I had no experience of yoga before that.
Yeah.
But I was taking these positions, and I was like, just releasing, like, just this energy like coming through me. And I was like really channeling it and releasing it, and going into child's pose and just like sobbing, like just crying for the loss of, the loss of like my childhood,
Yeah.
loss of connection with like joy from being a child, I mean, just deep, profound experiences. And then afterward, I just felt so good. I felt so fresh and light and free. I still think of my holotropic breathwork experiences as some of the most profound healing experiences of my life. So it's very interesting. You can get there without drugs, you know.
Well, right. I mean, that's the beautiful part, is that there's different strokes for different folks, right? So different
Yes.
levels of your comfortability of what you would like to try, where you think you're at. And
Yes.
there's options that are out there. I mean, I know I've had experiences connecting with my breath when I did a 10-day Vipassana, where you don't speak for 10 days and you sit in meditation and you learn to grid and get in tune with your breath. But
Mm.
these are faster, easier. I mean, they're faster ways to have a physical, emotional, mental connection experience
Yes.
of release or
Yes.
reconnection,
Yes.
without necessarily having 10 days to go and sit with yourself.
Um,
All very, very powerful,
yes.
but I can see where there's need for all of it.
Yes. Yeah. And I have deep respect for meditation, and I think in a way that's the maybe the purest way of having these deep, profound healing experiences. But it takes a lot of time and energy and effort. And psychedelics are kind of, they're kind of a shortcut, and they kind of fit into our busy,
World, right?
lives, right? They're just, and I just see it, I see them all as tools, and different tools for different people, different strokes for different folks, as you say. And but the psychedelics definitely have a place, I think. And so with Polaris, if I can share a little bit about the work I'm doing now,
Great.
I've kind of taken all of those experiences that I had with holotropic breath work, and then I also had a chance to take MDMA illegally with the MP1 study with MAPS on healthy volunteers, and so I learned a lot from those experiences, particularly about the container and about set and setting, the importance of that. Mm-hmm. And the importance of preparation, preparing the body, preparing the mind, preparing the spirit for a spiritual experience. Mm-hmm. And or maybe we could just call it a peak experience, to use Abraham Maslow's term. It's a broader term, peak experience, some very, very high experience that that these drugs can elicit. But we formed Polaris because we wanted to have a place where people could come that was very it's a controlled environment, but I don't want that to come off the wrong way, because it's a very relaxed environment. It's like a living room, like a typical room is like a living room setting. You have a couch and that folds out into a bed that you lie down on during the experience. We have pillows, blankets, eye shades. We kind of darken the room, so it's kind of a womb-like environment. We have
safe and comfortable.
Safe and comfortable, exactly. And
it's
then
almost nourishing, like nurturing.
Definitely. You want to, like with holotropic breathwork, you want to feel like someone is holding the space so that you can fully let go and feel whatever it is that you need to feel.
Yeah.
Yeah. And so we really kind of used our experiences with the medicine, with holotropic breathwork, to really inform how we set the clinic up and how we developed our protocol. And we also play music during the experience, and the music is such an important part of the experience. It's music along with the breath really helps us to connect with our heart and get out of our heads. And so we really coach people on how to do that. We spend a lot of time, having conversations about how to prepare in a good way, coming in with an intention, having an intention to do the work, taking care of your body, eating healthy, not trying to minimize or at least, use substances moderately before and after the experience, so that your vessel is as clear as possible in order to receive the medicine.
Sure. So are you working with clients one-on-one, or is this in a group, or?
So both. We started off doing individual sessions, and we still do that. And we also have expanded into doing group work.
Okay.
And so and then now with COVID, in the COVID times, we're actually also doing at-home sessions.
Okay.
Which is definitely kind of cutting edge, that we're, and this is only with people that we've worked with before in the clinic, and we've done an intake with and everything. So a new person coming in would not be able to do at-home sessions, but people that we've worked with before and that we feel comfortable moving to that stage with, we do offer that. And so we're Zooming together, and they have the medicine at home. They have the ketamine lozenges that you take, and it dissolves in the mouth, and it's absorbed buccally through the buccal membranes. And they have a psychedelic experience at home.
Yeah. How long does the ketamine last?
So great question. Ketamine lasts for about somewhere between an hour and a half.
Okay. So it's a much shorter duration.
Yes. Much shorter duration than a classical psychedelic, which is usually, somewhere between 4 and 6 hours. MDMA is 4 to 6 hours.
Okay.
So ketamine is shorter. It's kind of like the businessman or businesswoman psychedelic. You can come after work and have a psychedelic experience and then go home.
Okay.
Where a therapist is with the patient the whole time, the sessions are 3 hours, so there's plenty of time to go in, to come back, to kind of reorient and to process the material that arose in the session.
Right. Is the prep work for ketamine session the same as it would be for some of the other? Still want to clear the vessel, the body?
Oh yeah, definitely.
Right? Hydration is a key.
For sure. We talk a lot about that. Also psychologically, we talk same way that we talk with the participants in the MDMA study. We talk with our ketamine patients about things like having beginner's mind.
Yeah.
Going into the experience, even though you have a general intention of what you want to look at and work through, you also hold it lightly and ultimately let it go and just have an experience. So beginner's mind is like, you don't have expectations. You don't know what.
Well, yeah, sometimes you can go in with what you want, but you get what you need instead.
Exactly.
Yeah. It's the old prayer session where be careful what you ask for from God. You
just
might get what you want, but you might get something different, and that's really the blessing.
Mm-hmm. Yeah, and that makes me there's another concept that's really important in the work, which is the inner healing intelligence.
Yeah.
This is the capacity that I believe we all have within to intuitively go where we need to go in order to heal. Mm-hmm. And I think that this is operating at a deep level, but the mind gets in the way.
Right.
So we think that we know what we need to do to heal. We think and we overthink it.
Mhm.
And sometimes that's one of the limitations of traditional talk therapy, I think, is that you can gain insight and you can say, oh, okay, that's what I need to do. And oftentimes there's truth to that, but um, there's a limitation with being able to access this deeper level of healing intelligence with just talk therapy, and with bringing in the medicine to the psychotherapy, and extending the time and allowing for a deeper process to unfold. um, People are really able to go where they need to go to heal. And myself as a provider, I don't know what they need to heal. Oftentimes, that comes from the patient.
Right.
Our approach is like non-directive or inner directive. So it's really letting the patient's inner healing intelligence take the lead, and really just providing a supportive container and supporting and facilitating that process of them connecting with their hearts, connecting with the inner healing intelligence, and having the experience they need to have. So it's a new way of thinking about healing, which is really based on experience, learning from experience, rather than learning from insight through psychoanalysis, or learning from, um, practicing mindfulness through mindfulness-based CBT, or different from EMDR, which is a technique that you apply in order to get results. This is a much more broad and open-ended uh, method of healing, where you're really following the patient's lead, and the patient will go to wherever they need to go to heal, and it looks very different for different people.
Right. Right. I mean, what you're saying is so spot on with people generally know where they're out of alignment with their intuition or their gut feeling, or something's not right. And as children, we try to, I mean, as a parent, I try to teach my children, right for wrong, good and bad, don't run in the street. But until they have an experience, like get scared of something or something happened, then they really learn it.
Right.
Right. So that experiential is the best teacher.
I
And
think so.
we learn through our mistakes, or we learn through having a shift, not being told.
Yes.
I,
Yes.
I tell people all the time, just drink more water, just eat more fruits and vegetables. I mean, it's simple. We all know we should. And then we go to Taco Bell. So, or whatever. Right. So because we're stressed, or because we make up excuses, the mind is so powerful. It'll justify and talk us in and out of everything. And then we have thoughts about our thoughts. Right. So when we tend to overthink about it. So this therapy gets you not just access to what is best for you, but what you need right then, what your soul, what your spirit, what your connection to self and source needs.
Yes. 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 And it's coming from you. It's not coming from the therapist or the some authority figure.
Right.
Right. It's coming from you, and then because of that, you naturally develop a more authentic relationship with yourself when you realize that all of this wealth of information is available within.
Yeah.
It's just a matter of tuning in the right setting, connecting with the breath, connecting with the music, letting the medicine support you, and then you have access to all this information that is very valuable and that can be applied practically. It's just opens up doors for people. I mean, it's amazing to see. I mean, I've been doing talk therapy for 15 years and just been incorporating medicine in the work the last 3 years, and it's like a biologist that suddenly has access to a microscope. It's like just the work deepens so quickly and people get better so much faster. And I don't want to like glamorize it or idealize it too much, because it's not for everyone. One of the main factors in healing that has been shown in various studies is the patient's desire to heal. And I think people are in various stages of awakening to the importance of healing.
Yeah.
And I think a lot of people don't think that anything's wrong, and they're fine, and it's other people's fault or whatever. And they're in various stages of denial, and that's fine. But I think this work is not really going to be so effective for those types of people. I think you have to be humbled by life and get to a place where you're like, oh man, I need some help, and really be open to doing this deeper work. And so, we do a thorough intake process with people and kind of try to get a sense of where they are in terms of how they're thinking about themselves and their lives and their issues, and how much introspection they've done, and are they really ready to go into these deeper waters.
Oh, it's so true. When I opened mine in 2010, I thought everybody needs it. And then it took me about 3 years to settle down and go, no, not everybody wants it. Not everybody's ready for it.
Yes.
Yeah. And clients would come in and they'd have this great experience, and I wouldn't see them for a year or two. They weren't quite ready. And then, eventually would see people come back in. And this is 10 years later that I've had to go through this process of learning and being with people, learning to read their energies of where they're at, so that I could meet them where they're at, so I wouldn't overwhelm them with all the tools in my toolbox, right? Because not everybody.
Yes.
We start some people with water.
Yeah.
Heck, some days I'm just like, drink water. Go drink water.
Yeah.
Yeah.
It's kind of humbling as a provider to.
Well, it's just stepping back into humanity, stepping back into ourselves and connecting with one another and being of service. So I'm so grateful you're doing this work, because I feel it's a very necessary path right now, with so much trauma in the world. And everybody suffers from some sort of PTSD even as children make meaning out of things that are just small. We all are aware of these bigger traumas, sexual abuse or abuse in general, neglect, but there's the littler traumas, and those still create patterns in our lives that once we start to become aware of them, we can shift them.
Yes.
And ultimately create a better life for ourselves, our family, our community, and everyone in it, right? Profound work you're doing. I'm so excited.
Thank you, Rochelle. Yeah, I think we're both doing important work, and I really admire the work that you're doing as well with the nutrition and the flotation tanks and
clearing the vessel. We're just clearing the vessels.
Yeah.
So
I think just to kind of add to that, I think we're I do think that at a deep level, we're in the role of facilitating a reprogramming of the mind, and the first step is like education. Like, okay, here are the tools, and here is what's possible, and like, where are you, and like assessment, and where are you, and what do you need, and what do you want, and then there's some level of deprogramming, particularly in my field, and particularly in the work that I do, of like really questioning your beliefs, challenging old beliefs that are no longer serving you.
Sure.
And really kind of exploring, okay, like, you know, this feeling that I'm defective and that I'm not as smart as everyone else. And how is that playing out in your life, and how is that serving to as a kind of self-fulfilling prophecy to cause these repeating patterns in your life? And are there other ways of thinking about yourself? And is there, you know, the depressed mind will find evidence to support these negative beliefs to kind of reinforce them and recapitulate them. But the depressed mind is a limited program.
Mm-hmm.
And I think drugs like MDMA and ketamine help us to step outside of the program and outside of our conditioned mind, outside of depressed mind, and see what else is available, and what else, you know, who we are outside of those old worn out programs.
Right.
And we're so much more than we realize. We have so much more potential for creativity, for just energy, for projects, for thinking creatively, for connecting with spiritual experiences. For, you know, I mean, there's just so much as human beings. We have so much potential, and that's one of the things that through this work I've just really been so inspired by, is just how we can unlock our this much fuller potential through doing this deeper work.
Yeah, just listening to you, it's like, it's freedom. Sounds like there's some freedom from those old belief constraints that just keep us in this little bubble or box, as opposed to being more expansive.
Yeah, exactly.
Yeah, love it. I love it. Well, thank you so much, Dr. Eric, for coming and sharing with us what you're up to.
Oh, you're welcome, Marissa.
And the research that's going on. Please keep me updated on how that's going.
For sure.
I think it's super important right now, and right now especially, that humanity, especially in the United States, reconnects to ourselves. We've been disconnected and really suffering, I think, a lot on a societal level with trying to just keep up with life, that we've lost life.
Yeah.
Passions again, and our connection to love and each other. So yeah.
Well, I'm hoping that this that people take this opportunity, the crisis, to really, you know, start to ask the deeper questions and open up to these possibilities, and maybe, you know, use their time in different ways. And
well, it's been a theme that I'm hearing from people that I've been talking with, the women especially, that have children, that have had their children in so many different activities. Like they're just go. And one of the best things is that they've lost that sense of always having to go. And they're able to just enjoy each other and have dinners together again, and you know, reconnect in a way that they didn't realize they had lost that connection.
Beautiful.
With just the busyness of life, right? So I'm hopeful. I'm hopeful it'll stick around. Everybody won't just go right back to normal.
I hope so.
Me too. All right.
Well,
Thank you so much.
You too, Rochelle. It was a pleasure. Great to connect with you and catch up.
For sure. Thank you so much.
You're welcome. Bye.